Welcome back to We Are Austin. It may feel like a medical mystery if you're experiencing burning pain, tingling, or even numbness in your legs and your feet. But Dr. James Nin from 360 Medical Wellness and Neurology shed some light on the cause and some possible treatments for this condition called neuropathy. Good morning.
Good morning,
It's
Charlie.
great to see you. It's always nice to have you here.
Yeah, thanks for having me again. It's always an honor to be here again to talk to your viewers about pain and let them know there are options and you can get relief and that they don't have to continue suffering.
And that's what's really important.
Exactly, the quality of life. You know?
Yes.
So today I'd like to really talk about leg pain and foot pain because
Okay.
there's a huge confusion. I know it's very frustrating for patients to live with, but you know there are many different causes of leg pain and foot pain. I mean, you can have a metabolic issue, you can have a trauma, you can have an infection, you can have a circulatory issue, and then there's nerves, and then there's muscles. So many patients, they've gone through various forms of treatments from therapy, chiropractic care, and even to the extent of having surgery, and they're still dealing with the residual pain in their legs and their feet with this condition. So I like to categorize it in two types of pain, and especially now that we're talking about nerves and muscle here. It's really radiculopathy and neuropathy. But before I explain the difference, I really want you to picture the analogy of a electrical grid in your house.
Okay, got it. I'm picturing.
It's almost like the electrical nerve system of your body. Okay. So you look at the circuit box. Each fuse goes to a different part of the house. So your dining room has a fuse, your living room has a fuse, and your bathroom has a fuse. So if a circuit trips, the entire room is affected. Right? Well, your body's the exact same way. Different levels of your spine controls different parts of your legs and your arms and your body. So in radiculopathy, what we typically find is the cause is coming from the root nerve, which typically comes from the spine itself. Now, there are other causes, but generally speaking, that's the case. In neuropathy, you're usually dealing with an outlet that's gone out, or there's a stripped wire. I see. And it's not so much, generally speaking, coming from the root of the nerves. Now, the frustrating part is this. Whether you have radiculopathy or neuropathy, the symptoms are almost identical. I mean, they mask each other. So it's almost impossible, actually, for a patient to know, am I dealing with radiculopathy or neuropathy?
One or the other,
So most of the time, when they're dealing with excruciating pain, they end up in the urgent care or their physician's office. And so most of the time, the infections are ruled out, the blood clots, any circulatory issues are ruled out. So most of the time, we're pretty safe with just nerve or soft tissue or muscles.
Wow. And the important thing to know is that there are options for treatment. And what are those? And how can patients find that relief?
Well, when we're dealing with radiculopathy, because it is coming from the spine and it's coming from the root nerves, we're going to need an array of doctors and an array of specialists to work with to get you proper care. So most of the time, surgeons are great at what they do, but every surgeon is going to exhaust all conservative measures before you have to go to surgery. So most of the time, they're going to start with therapy, some chiropractic care, to really loosen any muscle issues or what's called pinched nerve in the spine. So once that's addressed, and most of the time it will solve the radiculopathy. In neuropathy, it's a little bit more frustrating. In fact, many doctors don't even like to talk about neuropathy because there's really no options for it other than just strong medication and narcotics. My brother and I developed a program actually for neuropathy. Has been extremely effective. In fact, we have over a 90% success rate with neuropathy. So either way, whether it's a radiculopathy or neuropathy, the most important thing is to identify what is it and what's causing it instead of just treating everything. Exactly. And the other frustrating part is some patients can't have both. So if you treat one, you can still have the symptoms of the other.
That's extremely confusing and frustrating for a patient. And fortunately for patients at home, there's an option here that we're providing you, and that's a free screening for the first 20 callers. And this is important because this will help you determine what is it that you have, what do the symptoms mean, and then of course the best course of treatment for you. First 20 callers get a free screening here from 360 Medical Wellness and Neurology. Dr. Nin, that's really important, and we appreciate you offering that to our viewers. I think that's very important.
Well, thank you very much, sir. And it is very important to identify the cause of it. Otherwise, you're just doing various treatments and just hoping something great happens.
But you're here to help and make sure you have results. We appreciate you being here.
Thank you for having me again,
Thanks so much for what you're doing. I appreciate it.